You know, all of medicine and dentistry is moving towards personalization, customization, and the toothbrush really hasn't had any dramatic changes over the last, I'd say, probably 100 years. And this is probably the most disruptive and dramatic change we're going to see in customization and personalization of toothbrushes. And so this is a 3D printed personal toothbrush that is able to get all the right angles and reduce the amount of time and reduce the amount of error in brushing. So really excited about this. You have a founder that's established in the dental profession and really understands some of the shortcomings of patients. And I think they've done a really good job with the design and really excited to see where it goes. Those are generic, don't really have bristles pointing in the right direction. I think it's just a one-size-fits-all model. These are actually custom made for each individual. So it starts off with a scan. That scan is sent to a digital design, and then this is actually fabricated for the individual. And so you should get a better brush, a more efficient experience, and a faster and healthier experience. I think we see the amount of stippling of the gums, the changes that occur after a couple weeks of using this, and so far the results have been really remarkable.
I love my ZEROBrush. So I've been using this for a while. It's 3D printed to my mouth. My fiance uses it, my kids use it, and we love the ZEROBrush, especially with the kids who just don't want to take the time. This whole thing, this takes 30 seconds to brush your entire mouth, and it gets it way cleaner than any of the toothbrushes. And believe me, being in dental for 20 years, I've used them all. So if you're interested, check out ZEROBrush at ZEROBrush.com.
I'm holding the ZEROBrush. This is a personalized, customized brush that's made from actually a dental scan of the mouth. So it's literally fit for your mouth to do effective plaque removal and maintenance. Dr. Pai, and what you've done is you've created a very personalized brush. But what I like is that you're not invasive in the soft tissue.
Yes.
People brush their teeth and they just shove it around and shove it around, even the electric brushes.
Yes. Yes.
And it was like, actually a mutual friend of ours, Dr. Ed Zuckerberg,
yes,
was the first to tell me about this.
Yes.
And I'm on the phone, he goes, I've got this great new brush.
Yes.
And he goes, you know, we're testing it out, and you really have to meet Nidhi,
yes,
you know, Dr. Pai here,
yes,
because he said, you know, she's really onto something.
Yes.
And my mouth, all I can tell you is how my mouth feels. The other thing why I feel so aligned with you is because you didn't give up.
Yes. It's a,
you had this idea for a customized toothbrush, and honestly, I didn't know what to expect. I did have the conversation with Dr. Ed, and he was telling me about it, and he kept saying, you have to meet Nidhi. He said, I think you're like, you know, like a Reese's peanut butter cup, you know, like you put the chocolate in the peanut butter, and, you know, you got the brush and the toothpaste, and both together really help create a healthier body.
We love our patients, and this is for the patients. This is for you guys. Yeah. This is going to make your, not only your mouth better, but your health better.
Yeah.
And so very excited. Thank you.
This is the future of sonic brushes.
Two legendary doctors here holding some legendary technology and products. What do you have in your hand, sir?
This is the ZEROBrush. And it is really, you know, we were talking on stage just before about how the future of dentistry is in personalized care. It's in prescriptive care. And, you know, this is really a prescription sonic brush. It's made from a scanned model of the teeth. So it's customized. You know, it's not one size fits all. And that's what you were saying about how...
Yeah, and, you know, it makes for an amazing delivery system for great toothpaste, right? Or other medicaments that a doctor wants to deliver to a patient's mouth.
Absolutely.
For sensitive teeth or remineralize decalcified areas, anything like that.
I'm Dr. Gerry Curatola, and I'm a dentist of over 43 years. And my favorite motto is, be true to your teeth or they'll be false to you.
Dr. Ed Zuckerberg, I've been a dentist now for almost 48 years. So if you ask my patients what it was like going to me, they would say two words: painless and inspect the gadget. I'm always an early adopter of technologies, and that is, you know, now enabling me to evaluate new technologies in the profession and, you know, help play a role in getting things that will move the needle funded.